A world traveler from San Francisco has brought home the United States' first confirmed case of the Omicron variant. Good evening. I'm Alan Martin.
And I'm Elizabeth Cook. We're told the patient was fully vaccinated but had not received a booster. That person is isolating at home tonight with mild symptoms as local health officials work on contact tracing.
It was inevitable, I think, for it to come to the United States, but that's a scary development.
With this new variant, then definitely gonna get on that train and get the second shot, and if need be, a third and fourth and fifth, whatever is necessary to stay healthy.
I'm not really worried about it. We live in a highly vaccinated area, so I think it's a little bit of hype.
Right now, the CDC is working to step up COVID testing requirements for people traveling to the U.S. Currently, travelers must be tested within 72 hours of arriving. KPIX5's Andria Borba on how Bay Area labs first detected Omicron and quickly.
Now, this all happened very, very quickly. It took less than 48 hours from the initial nasal swab to knowing that Omicron was in the United States in the Bay Area.
I'm almost certain that this finding is only the tip of the iceberg and that we will continue to see cases in the United States.
The timeline to finding Omicron in the United States kicked off Sunday afternoon when a patient recently back from South Africa took a PCR test in San Francisco. By Sunday night, the sample was at Keller Labs in Burlingame. Monday afternoon, via a text message link, the patient found out they were sick with COVID-19.
The patient themselves reached out to San Francisco Department of Public Health as soon as they knew that they were positive to provide more information because they were concerned themselves.
The patient then called DPH, saying they had been to South Africa. From that point, and it's now early Monday evening, extracted RNA from the patient's sample was brought to the China Basin lab of UCSF Dr. Charles Chiu for genomic sequencing. 6 hours later, near midnight, the answer was clear. Omicron was in the U.S.
We were able to identify the variant within hours because it has a very specific pattern of mutations.
The infected sample started off in this room, then moved to this traditional PCR testing device, and then finally this nano sequencer.
So essentially it's a microchip which consists of a bunch of electronics,
which is just slightly bigger than a USB stick.
And it's powered by the USB port in your laptop. And what it enables you to do is very rapid sequencing. And this is how we were able to get a result and be able to identify this variant within a few hours. If we had to run this on a traditional instrument, typically it takes at least a day.
Now, none of this would have happened if that patient had not told the San Francisco Department of Public Health that they had been in South Africa. This genomic sequencing wouldn't have happened, and we wouldn't know that this variant was already on U.S. shores. Though Dr. Chiu says it is very likely this is not the only case of this variant in the United States, just the only detected one. In San Francisco, Andria Borba, KPIX5.